the fact that 12 and under kids still are not able to be vaccinated, in your view, are there any kind of precautions during Fourth of July get-togethers or festivities that parents should be taking to protect them since they're not vaccinated?
So thanks, David. There are a couple factors that I would think about. First is that the risk of any type of serious COVID illness among those who are 12 and under is very, very low, and that's a good thing. The other thing is that we're now in summer. It's much easier to be outside, and we know very well that outside, this virus does not transmit very well. So the most important precaution parents can have is, first of all, do as many activities outside as possible so that if they're involving their children who are 12 and under, even if they're not vaccinated, their risk of getting COVID is much, much lower. The other piece is, of course, it depends on how many people are there at any events they're having. So if you are in a large crowd watching fireworks at a community picnic, there might be a large amount of people there, in which case I would probably advise that those kids wear masks as a precaution to the extent possible, or to maintain distance from others. But I think being outside and trying to reduce the size of crowds that you're in is probably the best way to reduce the risk for those who are unvaccinated, including those who are 12 and under.
But if you're in a crowd that is really large, you might want to consider having your child wear a mask.
Yeah, and I think that is helpful. It's not going to be totally protective, because what we know about masks is it's about both sides of this equation wearing a mask. So it's about the other members of the crowd as well, which is pretty unlikely. So I think that's where distancing comes in. Hopefully communities that are having July 4th events, if they're going to have a mixed crowd, the vaccinated and unvaccinated, they're thinking about how do we keep family groupings with a little bit of distance in order to reduce the risks that might be involved. Because certainly we're seeing the virus transmit among those who are not vaccinated. But again, kids are at very low risk of getting any type of serious illness.
Let's talk about the timeline for kids that are 12 to 15 or even older than that, if they haven't started to get their vaccines. Right now is sort of the cutoff for if they want to be fully vaccinated by the time they go back to school. We're kind of counting the weeks, and this would be when to do it, right?
Yeah, I think that realistically, for those who are 12 and under, we're not going to have vaccine approval in time for the beginning of the school year. I think it'll be sometime in the fall, based on what we've seen with other clinical trials as they lower the age range for those, for example, between ages 6 and 12 to be approved for vaccination. So going into the school year, I think we're still going to be relying on the fact that, first of all, kids are at very low risk of getting ill. Second, more and more people are vaccinated. So teachers, bus drivers, custodians, other school staff are going to be vaccinated. And so the risk of transmission to children in school is going to be low. And that schools have learned a lot about how to improve ventilation and improve circumstances so that kids can safely be in school. And so I'm optimistic for the school year. I don't think this is a barrier, but certainly as soon as the vaccine is approved for those who are younger, I would urge parents to do so, because we want that degree of protection. My son is 11. He's not vaccinated. My two older kids are. They're 14 and 16. As soon as the vaccine is approved for 11-year-olds, I'll be sure to get him vaccinated.
Yeah. And for students between 12 and 15 that I believe they qualify for the Pfizer vaccine. Mm-hmm. If you want to have them protected, fully protected by the start of school, you need to be doing it now, right? Getting them somewhere.
Yeah, that's correct. I mean, for the Pfizer vaccine, it's 2 shots, 3 weeks apart, and then you need to wait an additional 2 weeks for the full effect of the vaccine. So it's really a 5-week period of time. So I think you're absolutely correct. For any parents who are out there and are thinking about, I want my child who's 12 and above to be fully vaccinated by the time they start school, if they haven't already been vaccinated, now is the time to work up that process, because we're not that far away from the school year starting in many school districts.
Before we let you go, I want to ask you about the Delta variant. Obviously, lots of people are paying attention to this, given what has happened to other places, and it's become such the dominant strain of what's going on. And most recently, I think it was the governor of Illinois. I think it was the mayor of LA. Both of them saying, you may want to consider wearing masks again, even if you are vaccinated, because they're concerned about the spread of this. In your estimation, what do you think the best advice right now is concerning that? How concerned should we be?
Uh, the best evidence we have right now is that those who've been vaccinated, fully vaccinated with the Pfizer and Moderna vaccines should be safe. But what the governor of Illinois, what the mayor of Los Angeles are saying is that we have seen cases in other countries that transmit with the Delta variant, and there have been some breakthrough infections, not many, and not in the form of serious illness. So masking is a way to further protect yourself. But again, masking works best when many people are masking together, not just when one person is masked and everybody else isn't. We really don't have good data about that. So we know that the Delta variant is more transmissible. It does not seem to be, for those who are fully vaccinated, more virulent, more likely to cause serious illness. So it's going to be a balancing act. So I think the most important advice is, if you haven't gotten vaccinated at this point, this is another very important reason to get vaccinated as soon as possible, because it is very likely that the Delta variant will be transmitting much more in the United States over the summer and fall. And those who are vaccinated will be highly protected. Those who are not vaccinated may be very vulnerable to serious illness.